Hello everyone, we are in Module 12, the last module for this course, looking at technology and increasing access to care. For this lecture, we'll look at various technology applications that can really enhance access to care, particularly among populations for whom access to care is very limited because of so many barriers, including economic barriers, also lack of access to providers. The ratio of providers to patient is disproportionate or unbalanced. So we'll look at how, from the simplest technology to more advanced technology applications, how they could potentially address healthcare barriers, which is an important social determinant of health. Mobile application technology provide a really important opportunity in public health for intervention and prevention work, especially because it really requires very little effort on the patient to engage into treatment. Part of the recommendation, essential part of the recommendation to leverage technology within public health in addressing and potentially increasing access to care is because traditionally the treatment protocol where you meet with a patient for a number of weeks of sessions, let's say that you're doing a behavioral health intervention and you're required to meet with the patients weekly for over 6 or 9 month period. We see that over time, because of the participation burden due to number of sessions and over many months, attrition becomes really problematic. This is not only for behavioral health intervention, but other intervention as well, that people tend to drop out of a treatment because traditionally the standard treatment delivery is face-to-face. So folks with competing demands for their time tend to drop out of treatment. And also other populations have attrition is a problem for all populations, but it's particularly for disadvantaged populations. So technology application provides an opportunity to reach folks in their environment and also decreasing the number, decreasing participation burden by not asking folks to meet with you day to day over many months. So mobile platforms, as I mentioned, including phone, patient monitoring devices, personal digital assistants, sensors, etc. There's so many mobile technologies and platforms that provide really opportunities for providers or interventionists to intervene with the patient population. One of the reasons for the recommendation to leverage technology applications in public health intervention, because of the ubiquitous of, for example, smartphone among various population. As you can see, the demographic characteristic on the left, and it shows overall technology is pretty much ubiquitous. This technology, smartphones, pretty much ubiquitous among various demographic subgroups. A little bit lower in older folks, 65 plus, in terms of smartphone ownership in comparison to their younger counterparts. Nevertheless, overall, we see that the wide availability of smartphone among the U.S. population, also globally, there are a lot of data to show that smartphone ownership is pretty high worldwide, provides substantial opportunities for us to intervene and to engage with folks. This is particularly important in limited resource communities, as I said. I believe it was Module 10 or Module 9 when we look at barriers to access to care, looking at in certain areas where the ratio of available providers to patient is quite disproportionate. So you can have one provider to every 1,000 patients. So access to care becomes limited. Engagement and treatment can be very much delayed until the provider is available. So within these communities where it's very limited resource as it relates to providers or other related aspect of care delivery, these technological platform could provide an opportunity for treatment, that the provider does not even have to be in the environment, that they can remotely deliver treatment through mobile platforms, really bringing the doctor or the researcher to the patient when the patient is in their own environment. So accordingly, access to medical and psychiatric treatment as needed becomes doable with remote treatment. So short text messaging is one of the simplest type of technology. Short text messaging is part of the recommendation of technology application that can be leveraged in public health to increase access to care because it requires very low effort from the participant. And as I mentioned, participant can read a text message at their own convenience and wherever they are. And an intervention can be delivered at real time. So being able to reach the participant or the patient in their own environment require very low effort for them to just read a text message, and it's something that is convenient to them because you're not asking them to meet with you, and you can do this in real time based on data you've collected about the participants and based on the components of the technology. For example, there's some health apps that allow participants or patient to engage with the app, meaning that if there's an emerging barrier, you can actually use a keyword, help or extra help, and then there are treatment that are available to you. So you can engage in real time with addressing emerging barriers. But while technology such as text messaging, and there's been a lot of interventions using public health intervention using text messaging as a delivery platform, and they have shown promise in terms of helping people to live healthier lives by engaging in less risky behaviors. However, there's some limitations to them. So text messaging alone may not increase motivation to change, right? And essential part of change, for example, behavior change, it requires us to really, having a goal, understanding what the goal is, and being to monitor ourselves in terms of that goal is really important. These are important strategies that are associated with changing a behavior, being able to set goals, being able to monitor yourself vis-a-vis that goal, and having innovative ways to provide support throughout the change process. So how we go about changing a behavior, whether or not is exercising, eating healthy, taking your medication as prescribed, monitoring your blood pressure, monitoring your glucose level, all of these things. So having support can enhance engagement in behavior and help increase the likelihood of somebody changing a behavior and maintaining it over time. So support. So with the text messaging alone, it may feel like, well, by just delivering that, it may feel like there is not a supportive component. How do you get support from a text message alone? So hence the reason that another type of technologies that have been recommended that should be used as part of public health intervention are apps, right? Again, apps, or the use of apps, is pretty prevalent among the US population and also globally. These apps, behavioral health related apps, are being developed almost daily. And recent data, the most recent report on terms of app usability said 90% of mobile phone use is spent on using apps alone. So apps could be a solution in terms of further increasing engagement in public health intervention because of the ubiquity of app. mHealth strategies in mHealth is basically interventions that use mobile technologies for intervention, whether it's assessment or intervention type of research or programs, health programs. These type of work is referred as mHealth. So mHealth interventions using apps really could facilitate social support. So this is a way to virtually respond to the limitation of using text messaging alone to intervene for intervention. By having an app, it could be a way to provide social support. In my work, I have used a chat room component as part of an app to facilitate social support around physical activity engagement. So participants within the program are provided kind of a standardized, semi-standardized way of engaging in the chat room around various barriers and facilitators to physical activity. And this has been done in terms of various areas in public health, how to engage in various treatment, and having that chat room component could be one innovative way to provide social support. Also, app allow for goal setting. For example, you can monitor your goal in terms of eating behaviors relative to your goal in terms of weight loss. You can also monitor your goal with physical activity, and also it allows you to gauge where you are and potentially change your physical activity behavior to meet your goal. So what's depicted on the screen is, we know an app, this is a cell phone, and then the app is downloaded onto the cell phone, like a Fitbit app, for example. And as you know, a Fitbit device allow passive data collection of your heart rate, your movement. Passive data collection meaning that you don't have to enter the data. The data is just being collected as you wear this device to various sensors that allows the monitoring of your heart rate, your movement, even your breathing as it relates to stress. The newer Fitbit devices allow and facilitate data collection around how you're breathing and how it relates to stress, and may suggest some breathing exercise or other stress management exercise. So you can see the potential for apps, and by now we've seen that a lot of apps have been developed. A lot of health based apps have been developed. As mentioned on the previous slide, that the recommendation to use app as a medium for intervention in public health is because of the fact it facilitates the developments of so many components that could help with behavior change in terms of goal setting, monitoring your goal, your daily goal or your weekly goal as it relates to the target behavior, and also could have been shown to facilitate social support in terms of the target behavior, helping people who are trying to change a behavior, provide social support to one another. That's one innovative ways which apps have been used to facilitate engagement. However, despite the fact that app could be a potential solution, at least can be leveraged to augment care, augment engagement in behavioral health, we see that there's so many apps that exist, but yet a lot of the section of the population are unhealthy. For example, there's a lot of smoking related cessation apps, and this is based on the most recent data. About 400 apps exist, and apps are being delivered. These type of apps are being delivered, developed each, daily. But yet, 38,000 adult Americans still smoke, and about 480,000 die annually for smoking related diseases. So can these apps really, the availability of apps, using apps-based interventions, while it provides so many opportunities, however, is app the solution, to addressing various disease conditions? And part of it, what apps are being delivered, and not just, smoking related apps, cessation related apps, but other health behavior type of apps. And one of the question is that, okay, how do we determine which app to use? Because there are no consistent standards that app developers use to develop a smoking cessation app. Because oftentimes you are not dealing with researchers or scientists. So there are a lot of pros and cons to thinking about using an apps. So to help really advance this field, because we see the benefits of using an app, as I mentioned, even in my own work, using apps to facilitate social support around physical activity, it's pretty innovative because you don't have to meet with people to get peer support, get social support. You can be in your own home and access a chat room within the app and discuss the barriers you're facing and get social support that way. However, because there's not really a standard in place of how these apps should be developed, and these apps are not being developed with scientists, because you need scientists at the table, because along with the app developers, because scientists are experts based on their field of how we go about changing a behavior. What are some components that an app needs to have to increase the likelihood of somebody engaging in a new behavior and maintain it over time? In previous lectures, we looked at various models that explain behavior and behavior change. As trans-theoretical model, for example, that look at as we change, there are various stages that we go through, and with these stages are associated with various pros and cons for the target behavior. And also another change construct is self-efficacy, or perceived belief that we can engage in the behavior when faced with different barriers. So having scientists as well as the app developers work together to really inform how these apps should be developed, because there are no standards, and most apps have very little scientific support that use. Most apps that you see in the App Store or Apple Store have very little scientific evidence to support them. In addition to apps, emerging technologies have been deemed as having the opportunity to really optimize care, not only increase access to care, but optimize care. So we know it's not only access to care that's really important, social determinants of health, it's also quality of care. So robotics have been identified as a potentially increased accuracy of care, and also providing care in a short period of time, because they can complete many different tasks in a short period of time. This is particularly important for environment with limited resources. Blockchain is a structure that facilitates data collection, large data that can be used to provide very integrative care. Integrative care is recommended for increasing access to quality care, because information, for example, from different providers, about different diagnoses, can be within one platform, allowing a provider to access that information. So the more information a new provider, for example, has about a patient, it really helps with integrative care. And for example, there's some medications that a patient cannot be on based on certain conditions, or based on certain psychiatric conditions that they have. There's certain medication they cannot be on that can be very much addictive. And additionally, there's some medical conditions a patient might have that the doctor must know in order to provide medication for new presenting symptoms. So having an infrastructure where you can have information about the patient medical and psychiatric history really can facilitate integrative and thus quality care. So here are some, and also using these platforms like robots or robotics, or using the structure of a blockchain really can reduce healthcare costs. Artificial intelligence are emerging technologies that have been identified as having the potential to really revolutionize approaches used for monitoring and improving care. In addition to apps, these technologies can really revolutionize how care is delivered. Artificial intelligence is used in different fields, including in genetics, and also in surgical areas. Several studies have shown that AI can reliably complete various healthcare related tasks, including diagnosis of disease conditions. And also there is evidence to show that AI can actually be more reliable in certain areas in comparison to a human provider. For example, in identifying malignant tumors, AI have shown to be more accurate than human providers. Artificial intelligence is based on a combination of technologies, and tasks are performed based on algorithms or predictive models that pull information from the expert system. So expert system is based on a collection of if and then rules. Basically, if I use expert-based system interventions in my work, meaning you collect information about a behavior, and I will use physical activity since I'm primarily a physical activity researcher, based on surveys, assessing barriers, and facilitators physical activity from the participant, and other type of survey. Based on that data, I use if and then rules. So if somebody is shown to have low self-efficacy to engage in physical activity based on a score on this measure, then the expert system says if this person received less than a 5 on this, then they should receive this type of intervention message to help them increase their self-efficacy. So it's based on if-then rules. So if you have this, then this is what you receive. You can look at AI also in search engine that you may have done. So if you've gone online and you were looking for something in particular, let's say you were looking up information on a particular exercise, or you were looking other information and you were wanting to purchase a type of furniture, whatever it may be, the next time you log on, you're likely to see advertisements that are very similar to based on your previous search engine. This is using AI based on various algorithms that if you were looking up information on exercise, you might be interested on these other type of exercises, or even exercise clothing. Also, if you were looking at information based on this type of furniture or sofa, here's information about other type of sofas or similar sofas you might be interested in. So it's really pulling information about a user, about a participant, and using algorithms to deliver things that might be tailored, that are tailored to you, based on information collected from you. Machine learning is also commonly used in artificial intelligence, also in the area of treatment approaches. Intervention where they're using AI to determine a diagnosis based on the patient's presenting symptoms. These are models that have been developed through machine learning, and this require large data. You feeding that data into the system to really teach it how to discern among certain symptoms in order to indicate whether this is diagnosis A versus diagnosis B. So these are very smart systems that are machine learning really is commonly used AI to determine which treatment approaches based on various models, and teaching the machine how to determine disease conditions, absence of a disease conditions versus presence of disease conditions based on the attributes of the disease and non-attributes of the disease, okay? Based on the previous slide, you can see the importance of AI in really increase access to care and also tailored care. And one way that AI is being used is Beth Israel Deaconess Hospital in Massachusetts, which is one of the top hospitals in the U.S. So doctors are using AI-enhanced microscope to scan for harmful bacteria in blood samples at a faster rate than it is possible using manual scanning. The scientists used 25,000 image of blood samples to teach the machines how to search for bacteria. The machine then learned how to identify and predict harmful bacteria in blood with 95% accuracy. So using machine learning, that only task can be completed in a short period of time, but also with fairly great accuracy. So this is an example of how robots are being used in healthcare. Adam scored billions of data points in public data set to hypothesize about the function of 19 genes within yeast, predicting new inaccurate hypotheses. Adam's robot friend Eve discovered triclosan, a common ingredient in toothpaste, can combat malaria-based parasites. So this is one of the many ways that artificial intelligence are being used to really expand medical treatment and also increase understanding of disease conditions and develop new approach ways of how to combat various conditions. This is really important discovery. Not only could really facilitate access to care by decreasing the amount of time a provider used, but also using robots to deliver care, but also it could facilitate the discovery of new treatment for various conditions. So AI and big data. AI use big data. Machine learning use big data. And how can this really is relevant with public health? When hospitals have surmountable of data collected annually from just even intervention or annual checkups through management of disease type of treatment protocol. There's the velocity of data is infinite that we have that oftentimes are not being used. So big data, which is really needed for machine learning, we have that information from hospitals and clinics annually. And we also have variety of data, structured data, into semi-structured data, log files, and X-ray, unstructured data. So all of these various types of data can be used to really for integrative care, but also for allow machine learning to develop more comprehensive models to help intervene in impoverished, especially in an impoverished setting where there is not a lot of human providers. So machine-based type of interventions can really help increase access to care diagnoses. The veracity of the information is really important, because think about machine learning. Machine learning is based on is developing models based on the data you've entered to it. So if the data is not accurate, then the model you will get is pretty much trash. So the value of using this information is, as I mentioned, disease detection, better treatment, and also cost reduction with, for example, paying a person to scan thousands of data is really costly versus teaching machines of how to do that. This figure depicts the big data characteristic we've just gone over in previous slide, as well as the data infrastructure needed to facilitate the collection of big data, and also how big data are used in artificial intelligence for AI, for modeling, and various statistics that are used to develop models that are used around diagnosis of a disease conditions and diagnosing of a disease condition. That information therefore is used to facilitate treatment protocol. So modeling, data mining, facilitated knowledge discovery based on different trends that the machine is able to detect based on various models. So correlation among abnormalities. So it may be that you use one data set to explore patterns, and you will also use another similar data set to confirm patterns that you've seen as it relates to symptoms relative to various disease conditions. Visualization, exploration, identifying trends visually, and looking at quantitative classification, so grouping of certain characteristic of clusters of characteristics. So data clustering really allow you to group items or individuals that share various attributes. These are all various type of models that are used in AI-based modeling. Hypothesis testing, evaluate various statements to determine which statement is supported by the sample data. So this is all part of developing a model and also confirming a model. So regression analysis also allows to explore relationship among variables within a data set. What are the strong predictors associated with the likelihood of a disease conditions? What are significant correlates for treatment outcome? So there are various approaches that are used in AI as it relates to developing accuracy of models based on hypothesis testing and based on other and confirmatory approaches that really facilitate really robust models that can therefore be used in diagnosis of disease, as well as predict approaches for treatment protocol. So public health impact is AI can really help increase precision in terms of public health intervention, allow for more tailored treatments among various groups, especially in groups where there is very little research. A lot of minority population, low-income population may not be represented. A lot of subgroups may not be represented within research. When we talk about the sexual minorities are often underrepresented in research. So a lot of public health models in terms of treatment may not be relevant for this population. So AI, in terms of developing through machine learning, including could really help to test models for treatment among this population. Allowed to stratifying and segmenting the population for different risk conditions. We've gone over that. Opportunities for ways to decrease disease conditions, because if you have models that can really predict the likelihood of disease condition accordingly, it facilitates knowledge to help develop intervention approaches that can decrease the risk for disease conditions among different population or subgroups. And accordingly, AI, these emerging technologies, are really gives us an opportunity within public health to do much more prevention science, which public health, unfortunately, is not a prevention science, is more of an intervention science. But with prevention science, we really can engage vulnerable population and decrease rates of chronic disease prematurely and allow for more integrative care. Integrative and finite tailoring. And tailoring is really important. As I mentioned, access to care is not just access to treatment. When a treatment is tailored to you, it's integrative, meaning it's using a lot of different information, different resources to inform care, and is tailored to your needs. The patient is more likely to engage in treatment and maintain engagement in treatment for a long period of time. While AI and these other emerging technologies are really providing really substantial opportunities to increase access to care, to really deliver quality care by facilitate integrative care and tailored care. These technologies, while there are empirical support for the accuracy of AI in, like, for example, detection of diseases, as it relates to tumors, malignant tumors, identifying malignant tumors, there are areas where much more research is needed to really test the efficacy of these type of technology-based approaches. So we're still in the stage of promising rather than delivery. Michi et al. Mentioned, because these technologies have not been tested in various areas within public health. So using these technologies in an area where there is limited research in terms of treatment and increasing care access as it relates to treating a certain disease condition for which there is very little or limited scientific support for how to use machine learning, can actually adversely impact care. And also regulation of these technologies. So there is not really, if you're using AI, if you're using machine learning, if you're using robots, there has to be a standard approaches that providers or interventionists have to adhere to. So these things are being developed. There's not really a standard, or what is the governing body that really determine various regulations that should be followed. When using big data, when using patients' information, annual patient information, and whether it's prevention, intervention care, we have to think about data ownership. Can we just simply go into a hospital and go through IRB and obtain approval, or do that approval also require patient consent? A lot of hospitals are actually asking, part of, if you go certain visits, medical visits, you may get a blur, a paragraph within the consent form that shows your information also be used for research. So we also have to think about data ownership. And even I'm not sure how knowledgeable you are in terms of research. So to do research, you have to get IRB approval, which is your institutional review board, that look at your proposal for the research you're proposing to conduct, and based on that, it determine whether or not the various risks to participants, and determine whether the research has minimal risk or high risk, and you have to explain why this risk are absolutely needed, or there is low risk or moderate risk needed to really extend this area, the scientific area. And based on the review boards, they tell you a yay or nay or things you need to change. But with these new technologies, you need expert in that technology to be part of the institutional review board, because if you're not expert in the field, you have very limited knowledge how to review research proposals, or how to review proposals that are proposing to leverage AI as part of a clinical trial or as part of a standard treatment. So guidelines for institutional review board to review studies, using AI, because we need more studies to really understand AI in various other areas, if we are gonna widely use AI as part of medical care. All right. So benchmark for precision of models is also part of how these technologies can, more work that is really needed to extend knowledge about AI. So what is the benchmark for precision of a model in terms of disease conditions? Because errors can potentially cost human life. While the extension, so do we say that the model must have 99% accuracy? Do we say 95% accuracy? And so we have to think about it, a small error can actually cost human life. So the using machine learning to identify certain cancers versus others, if it's inaccurate, therefore has a dire potential and a dire effect on a human life, because if there is no detection of cancers, so there is no treatment intervention, that could potentially cost human life. So if you're using machine learning, if you're using AI for detection of disease conditions or diagnosis of disease conditions, who's accountable? But where AI is being used in public health as it relates to healthcare treatment, medical treatment, oftentimes there is a medical person that also review the output, the diagnosis, as well as recommended treatment. Transparency is really important, because one of the recommendation is really to use these technologies could really be useful in communities, impoverished communities, low resource communities. It's really to be transparent about with patients what is part of their healthcare. If AI is being used, it should be very much transparent that AI is being used as part of diagnosis approach. And having people that are very knowledgeable to explain certain the procedures. There may not, you have to make sure that people are knowledgeable and understanding and explaining the approaches of artificial intelligence. Issues of permission and privacy, adequately informing the participant or the patient that their information is going to be used for research. And as I mentioned, a lot of hospitals are already doing it. But if the wide usability of these big data to inform models that can be used for diagnoses and treatment, we absolutely have to adequately continue to inform folks how their data can be used. and how much control that you have. Oftentimes, if your information is de-identified, and a lot of our medical information is de-identified, the standard approach really now is that patients are not notified that your information is being used for research. So potential barriers of implementing AI is that it can be really difficult to integrate in various systems because you need an important infrastructure to facilitate data collections and maintenance, maintaining large data and technologies and expertise, folks that have expertise in these type of technology-based approaches. And right now, really a small group of population really understand AI technologies as it relates to diagnosis, as it relates to informing treatment protocols. So a lot of research is really, as I mentioned, redid, and it's really important to reiterate this, that while these technologies are very promising, but more research is really needed because to increase right expansion in health and increasing access to care among different population. And we have to really think about receptibility. Transparency is important, but if you're being told as a patient that AI was used to determine your diagnosis, are you going to be receptive to this diagnosis, or are you going to question the accuracy of it? So we have to think about that opportunity. To summarize, so a recap: technologies can serve as viable platform and help us to leverage strategies that can help increase access to care across a wide range of people and populations. AI and big data have the ability to really increase our understanding about factors that serve as mechanism that are therefore must be addressed in any programs or intervention addressing disease conditions and improving health outcome. In any population, we need clear strategies for engaging and intervening in different subgroups using these different technologies. More scientific evidence is also needed to establish the efficacy of these platforms in their integration to Medicare. While there's been a lot done, but in terms of scientific efficacy research assessing the efficacy of these strategies, it's still a burgeoning or developing field. All right, here's some reference. This is the last module, and I wish you the best of luck. All right, bye.